Hey guys, welcome back. We have a brand new season of Conversations with Dr. Gosalia. This season, we have all new topics, all new people. And today I'm really excited to interview and welcome Dr. Emily McMahan and Dr. Tish Gaffney. Guys, thanks for being here. I'm actually going to jump right in and ask you, what is the Audiology Practice Standards Organization?
So the Audiology Practice Standards Organization is pretty much what it says. It's an organization that exists to create standards for audiology, for all of the things we do, from our intake through amplification, diagnostics, vestibular. So our goal is to create these standards for our practice, and our mission, as per the website, is to develop, maintain, and promote national standards for the practice of audiology, which are based on current evidence, reflect best practices in the profession, and are universally adopted by practitioners.
The only thing I would add to that is, in audiology, our field currently doesn't have any national standard guidelines. Different organizations have different rules, so to say, that they go by. And so this will allow our field to be able to move forward in a uniform way that makes sure that all of our patients across the country are receiving the same level of care, regardless of where they are being seen.
Yeah, that's fantastic. So let's introduce ourselves. I wanted to get that out of the way first, just so everyone understands what APSO is. We call it APSO. So Dr. Gaffney, if you don't mind starting off, just tell us a little bit about yourself, where you are, what you're doing in audiology.
So I am faculty at Nova Southeastern University in Fort Lauderdale, Florida. I primarily teach in the areas of vestibular and amplification. And so, I'm currently the president of APSO, as well as I volunteer in, several other organizations for audiology.
Yeah, you've been a big leader. I've worked with you many times over the past many years. We're getting older, and appreciate all of your leadership. And so you basically teach hearing and balance, it sounds like.
Yeah, the both ends of audiology spectrum, right?
Very nice, very nice. And Dr. McMahan, tell us, I've known you for years. In fact, the first time we met, you were a student, and we met at AAA. So tell us about you and your practice in Alaska.
Yeah, so I own Alaska Hearing and Tinnitus Center. We have 2 private practice locations. Our focus is both hearing and also tinnitus. We are working and expanding our services, and currently are seeing all hearing aids, both daily wear and implantables. And then also we work a lot with tinnitus patients. We do a lot of remote care. Being in Alaska, I don't always see my patients in person as often as most of the rest of you do, but we're really excited about it. As far as audiology, I've been on the APSO board for a couple of years now, and I am president-elect for 2022. And so, we're really excited to see this organization go. It's something that as a student, I was asking, why don't we have this? And so, I'm really thankful to have been a part of this organization and see it go forward. And I'm just looking forward to making these standards officially out there.
Yeah, you guys have both been big leaders in the profession. Anytime I think about leaders in audiology, I always see your faces come up as well. So, what is it about volunteering for the greater good of audiology that really gets you guys going, and why do you do it?
For me, I had amazing mentors while I was a student. And if I hadn't had solid mentors, yourself being one of them included, I don't know that I would be in the position where I am in the field today. And if we don't give back to our younger audiologists and our up and coming providers one day, I just don't feel that we're doing our profession a service. Our newer providers are coming in, they have fresh ideas, they have good learning, they're having excellent, different things that they're seeing out in today's world. And that's not to be forgotten. Yes, longevity goes a long way. Yes, having the knowledge of working for a long time. But if we don't adapt those newer standards and those newer, students and how that they're learning, we're just not doing ourselves any service. So for me, one of my ways of giving back to audiology, other than volunteering on this board and some other organizations, is always making sure that I have a student in my practice. So being in Alaska, I've only had 1 third-year student because there's no programs near me, but COVID allowed me to have a 3rd year. And then I often currently have a 4th year, and I just accepted a 4th year offer for next year today. So, for me, having students and helping to show them and guide them is, really important for me.
Yeah, perfect. And Dr. Gaffney.
So my volunteer started when I was a student. I was at the University of Pittsburgh, and we were transitioning to the AUD, and I went to my first AAA convention in Philly. So there's a throwback to whenever anybody remembers the AAA in Philly.
Dude,
It was just my hometown, so it was nice to have my first conference in my hometown. But we found out about NAFTA, and there's another throwback to, the National Association for Future Doctors of Audiology. And so my classmate and I are like, let's start a chapter at Pitt. And I became the national representative. And so it became this kind of snowball. Once I got involved as a student and then I graduated, it was, what can I volunteer for? Because I feel like you are helping to define your profession and, and define the future of audiology in essence. And so I really feel like it's important to give back and to help shape that future. And especially as a professor, showing students how to volunteer and kind of making it a better, profession for them to enter into. So it started as a student, and I've never stopped since then.
Yeah, not only do I remember Philadelphia AAA, I also don't remember parts of Philadelphia AAA. That's outside of our conversation here today. Here we're talking about standards. And so if we talk about standards, or we're talking about standards, but we keep talking about best practices in our profession. So people have a hard time understanding what standards really are in relationship to best practices and scope of practice and practice guidelines. Can you guys help us understand the difference between standards and all those other topics, please?
Sure. So, we look at practice guidelines and best practices, and that's really, kind of the best way to go about it. But you need a foundation for all of that, and that's really what the standards are. The standards are the foundation that what the typical provider would do, kind of the basic bare minimum that you should be doing as an audiologist. And on our website, we have a great graphic that kind of describes the differences between standards, guidelines, and best practices. But really, we're looking at that foundation. What is the typical audiologist doing? And then the best practices and things are built on top of that.
Yeah, in fact, our editing crew just put that up on the screen while you were talking. They do a fantastic job, by the way.
And the only thing I would say to add off of that is there's a lot of misunderstanding about what practice standards are. And so I would encourage you all to take the time and go and look at our organization's website. It's really clear cut. And a lot of misunderstanding comes from, we're not trying to create standards to say that should be their level of practice. We're creating standards to show you what at minimally you should be working towards and striving to do further from that. But with an audiology, we use the word best practices a lot. And it's really hard to have universal best practices if we don't have a universal standard present. So, getting behind this is not taking away from our profession. It's strengthening us so that when we need to stand up against other organizations, we can say why these are our foundational skills and why we should be doing more than just that.
Yeah, and there's probably a legal aspect of it too, right? To protect ourselves, having these standards as well. So, actually, what the audience may not know is I was president of APSO back a couple of years ago, and one of the standards that we actually started, we tried to get one out. We thought it would be easy. It actually took a very long time to get it out, which was just the general intake standards, right? So when a patient comes in your doors, what are the things that we need to ask them, or what information do we need to get from them? So APS actually published that standard, and since then, what has APSO been doing?
So since you left us, we have gone on to publish the adult and geriatric hearing aid standard. We are currently working on the pediatric hearing aid standard, and we are starting to gear up for adult diagnostic.
Just knowing how hard it was to get general intake standards. The amplification, which is the one that's being published right now, that must have been a bear to work through, because there's probably thousands of moving parts and so many branches that you can go off of. So can you tell us more about the amplification standards and what does that entail?
Sure. So each of the standards that have been published and are currently being published have a team of subject matter experts that are a part of that. So we have a team of SME that have either been self-nominated, nominated throughout the field. They go through a ranking process so that we as a board can make sure that this is a unbiased group, but also as a group that has the right knowledge and backing to be a part of creating a standard. So you'll see a lot of those familiar names when you look at the standards published, because these are some of the four leaders and four founders of our profession that have worked on creating these different areas. So in terms of amplification standard, our most recent one that's just created there's a lot of discrepancy on what does picking out and moving forward with amplification look like. Are patients given all the same information? Do they feel like they have choices? Are they only given one option? What does that process look like? And it's definitely not uniform. And we don't have to create this in the sense of uniformity doesn't mean taking away from your individual provider abilities, but uniformity means have you checked off all these different things? Because if you haven't, what is your patient missing? And so for amplification standards, you would think it would be fairly straightforward, right? We all know we talk about during that side of our practice, but it wasn't. And there was a lot of back and forth discussion, and it finally came through, and we're really proud of our newest standard. But I would definitely encourage people to take a peek at it. It's containing things that shouldn't be too difficult, but we found we're missing quite a bit in a lot of different practices.
Yeah, and periodically through this interview, I've been putting the link down below. I'm sorry, our IT team who does all the editing. They've been, they're fantastic. They're the best in the industry. They've been putting the link down below where you can actually go on and take a look. So I always, I've given a few talks on standards. And one of the things that I like to throw out there is, when we've been talking about real ear being best practices, I will always ask that the audience is doing verification on hearing aid fittings. Is that best practices? Or should that be the standard? So I'm sorry, I'm throwing this at you. Can you answer? Is that part of the standard? I haven't looked at it.
Maybe you should visit that website.
I should go down and visit the website.
Your IT team for that address.
So there is a standard component related to verification. So it doesn't specifically state what form of way to measure that, but there is a verification component, and it really it should be real ear. It doesn't specifically state real ear, but it does say verification of speech in the ear canal, so it kind of alludes to real ear.
And I think that's the correct way to do it, right? So when we talk about standards, we're thinking more high level. Hey, this is what you do in a particular situation, but how you do it is practice guidelines, right? So I think the standards should be more high level. And that was one of the tricky things we had in the beginning. And, truth be told, even us that were on the board, a lot of us we kept mixing up guidelines with standards, saying, well, no, we should do these easy. And then luckily, John Coverstone, who was one of the brainchild behind this, along with a handful of others, really came out saying, no, that's guidelines. These are standards. So what you just said, Tish, is correct. I mean, how to do it, which it should be real ear. It could be live speech mapping. It could be, definitely not the whisper test, but it could be something where we're doing verification, but at least that's the standard. So who should be paying attention to this? I mean, do we really care about all this? I mean, who should be paying attention to standards?
Honestly, I think anyone that's practicing or plans to be practicing should be paying attention. Other areas of medicine in the medical field have standards for their profession. Ours does not at this time. We're working on it. We're getting progress. We've published a few. But if you're currently practicing and you were to need to go into court to defend what actions you would take with a patient, what level do we have to stand on right now? Right now, we don't have any. We have AMP standards and intake, but that's certainly not covering our whole profession. So in my opinion, if you're a practicing audiologist, whether you are in the educational setting, the industrial setting, seeing patients, this is important. And if you're a student, I would highly encourage you to join us so that you can learn and have a good, solid starting foundation to your practicing life.
I would also add in, universities as far as what they're teaching as what students should be doing as the bare minimum going out into the profession, as well as some of our regulatory bodies like our licensing boards and things like that, to make sure that they're in line with the standards that are being produced. Yeah,
the beauty of APSO is that we've been very apolitical in the sense that we reached out to ASHA, AAA, ADA, and I think even there's some other organizations as well, in making sure that everyone's on the same page here, that we're creating these standards as something that needs to affect every audiologist, and it will. And I think our original idea, which I think is still the idea, as you just mentioned, is to get the licensure boards involved. And hey, every state should also adopt these standards. So it's very important that everyone who's watching this really understands that standards are going to affect you whether you like it or not. So we just talked about hearing aid fitting. I think somebody already mentioned it earlier, but what is the next round of standards that you guys are working on?
So we're currently working on the pediatric amplification. So we actually have, I think, most of the initial draft of that done. We kind of rolled the adult SMEs into pediatric. Few people dropped off, few people added on for the change to pediatric. But the core group of the SMEs know pediatric and adult amplification, and so most of them were able to just kind of roll one into the other. So that one has been easily moving along. We are currently now also pursuing SMEs for the adult diagnostic standard.
Very cool.
And our goal is to kind of cover all the basic, the things that most audiologists do, and then follow that up with more specialized ones later, like tinnitus and vestibular, etc.
Yeah.
We're just going to focus on the majority first. That way it covers the vast majority of our field, and then we'll get more into those specialty topics.
Yeah, I remember some of the topics we came up with. I had never even thought about pediatric vestibular, and that's actually something that is not as common. So of course that might be pushed a little further down, but it definitely will be covered. So we can go on audiologystandards.org, correct? And we can actually view these. Do we have to purchase the standards? And how can audiologists and or sponsors, and of course, I know that, you guys know that it costs money to run an organization. So of course, sponsors are a great help to the organization, gives them exposure to the public as well. What can people do? Where can they find this information? And do we have to purchase the standards?
So the standards are available to Audiology. We've published them, we've shared with them. They're not a secret. If you want to become a member, though, we do have membership with very low dues. If you're already an audiologist, your dues are $50 a year. If you're a student at any level of student, it's a $35 membership. We highly encourage you to participate in that. Because we are an all volunteer organization, those dues go to covering for our legal fees of having everything evaluated and looked over by lawyers to make sure that we're not out of line or missing an important aspect. We are an entirely all volunteer board, so there's no money of those dues that comes into us. It's specifically going back into the organization. Luckily, that means we can be a fairly low cost organization, but sponsorship always helps us. It allows us to move forward with the legal aspects of these SME boards and everything moving faster. With 2020, we didn't have a lot of sponsors. So if anyone out there wants to help, we would not tell you no. Contact either one of us. We'll get you in the direction. And we also do have a few scholarships left over. We had someone generously donate some scholarships to students. So if you're a student looking forward and you can't afford the $35, that's okay. Send us an email and we're happy to help get you in the right position.
Yeah, and those sponsors, especially when we talk about like hearing aid standards, and I'm kind of looking at you, hearing aid manufacturers, this is definitely something that kind of falls in line with you guys, along with some of those manufacturers of verification equipment. So these are topics that sponsors can really, tie themselves to as being, critical components of getting these things going. So guys, really, really, really thank you for not only doing this today, but everything you guys do for the profession. You guys are champions of audiology, and we really appreciate everything you guys do. As I said earlier, you can visit audiologystandards.org, where they have all of the published standards that have been done already, and even some timelines, and you can read up about standards and learn more. And any final words, guys, before we hang up?
Check out the website. We also have a Facebook group where you can get up-to-date information. We post things there as far as what's coming out, what's up for review, etc. And be a member. Support standards.
I would also add to that, be a member. We always need help. We, the board, can't be the SMEs for everything that we put out. I am not qualified to be an SME in other areas that I don't currently practice in. So if you have someone in your life that is a really specialty or feel strongly for, creating something along those guidelines, send their name in. We're always looking for help. This is why we're a nonpartisan organization. We didn't team up with any of the big membership so that we could be able to create something uniform without having kind of the political side of audiology inside of it. So we don't care what part of the practice you're working in or what you're not doing, but if you have someone that knows and wants to be a role, we would love to have them join us.
And you don't have to be a member of APSO to be a subject matter expert. I think that's important as well. Well, guys, thank you so much. Please visit audiologiststandards.org, and we look forward to seeing everybody live soon. Thanks, guys.
Thank you.
Thanks.